Thank you very much. I think I received a marching order that I need to deliver my presentation in 5 minutes instead of 10. So I better start. I want just to start by saying that this topic of today is certainly timely. Is topical, and it's important that we have a privilege to have with us Minister of Finance, Minister of Health, and to start reflecting on our collective success and trying to also learn from where we can really be improving our strategy to be cost-effective, to be certainly having value for money, but also to reflect on sustainability of our programs. I want just to start by saying that just a few years ago, no one could believe that we could even put people on treatment, or HIV treatment in Africa. People were saying, I remember in 2001 when we were negotiating this declaration in New York, that is too costly, that we could not afford to pay for people, to poor people, to put them on treatment. And that was not far ago. The treatment cost was $15,000 per person per year. And today, I want just to say that we have been able to demonstrate that we could put people on treatment in a very poor setting. Today, we have almost 6 million people in Africa on treatment. Those days, we were having less than 50,000 people. That is, for me, just the way to demonstrate that we can have a result. But why it was also value for money? Why you, Minister of Finance, you need to really pay attention? Because it produced impact. It was not just producing coverage and putting people on treatment. In 2000, during the last 5 years, I can just say in 2005, we were having almost 2 million people who were dying in this continent from HIV/AIDS. This year, we're talking about 1.2 million people. We have been able to reduce this number drastically. We have been showing also that we can avert death and also babies being born with HIV. Just last year, 600,000 less babies were born with HIV. So I want to say that it is important for us to understand that HIV/AIDS was helping us to produce results, but also to use effectively those resources which has been mobilized through global solidarity, thanks to Global Fund, PEPFAR, and others who have been bringing this money. But why is important for us to go beyond that one? If you reflect on our success, what was happening, you can see that this success is very fragile. Most of the countries who have been able to put millions of people on treatment, they have been able to put those people on treatment based on resources, financial resources coming from outside of the continent. Almost 90% of the people who are on treatment today are on treatment based on a Global Fund and PEPFAR funds, which is very good, thanks to them, but we need really to have a shift of paradigm. We cannot believe that we can put someone on treatment, millions of people on treatment, and keep them on treatment for 30 years based on resources which is coming from outside. So that's why it's important, if we want to really address the issues of sustainability, to start talking about shared responsibility based on shared values and mutual accountability. And that shared responsibility, we need to really be able to explore new mechanisms, funding mechanisms, looking on our domestic fund, and I'm seeing that happening in many places. South Africa increased by almost 40% their resources, and this is today we are talking about $1.9 billion invested, and which is for us very important. We are seeing also this change happening in different places. I want to say also, because I have only 2 minutes, that it's not just the dependency on funding, it's the dependency on research. We need to build a knowledge-based economy. It's impossible to have our research vision for the future based only on ideas coming from outside of the continent. So it's important to think about how we can really start looking on continental vision for having our research base, but also reduce our dependency on medicine. That is my last minute. And today, thanks to India, almost 90% of the drugs we are giving to our people on HIV are drugs coming from India. And I believe, honestly, that Africa can start producing locally the medicine, and it can be done in a very organized manner, strategic manner, by making sure that we can sustain our gain on long term. Thank you very much.